Thank you very much, the organizer and the moderator and distinguished audience. I'm very glad to be here. Um, Thank you for the opportunity to share knowledge together about this very important disease in our community and affecting everyone. Hypertension is a very important disease that affects all ages, particularly the adults and middle age people. Now it's also common among young people, the teenagers. It affects men and women, it affects people of different socio-economic status. So when we talk about hypertension or high blood pressure, in the general term, it's and then uh, in global definition, the meaning generally all over the world, it means that the blood pressure of that person is higher than one is as high as 140 milliliters of mercury and above, all over 90 milliliters of mercury and above. Meaning that when we take blood pressure, there are two components, the upper one and the lower one. So the upper one, we call it systolic blood pressure, and the lower one, we call it diastolic blood pressure. When the upper one is 140 liters of mercury and above, or the lower one is 90 and above, it's not necessarily that the two should be there. Once one of them cross that line, that threshold, and is persistent, that is hypertension or high blood pressure. That is the general and simple definition of high blood pressure or hypertension. So we use the two words interchangeably. High blood pressure, hypertension. We use it interchangeably. That is the simple definition of hypertension. Thank you.
Thank you so much for responding, Prof. So, Prof, please, sir, I'm very, very sure that a number of people might not understand the importance of this thing to health, especially as a platform that is addressing prevention. A lot of people actually come down with a lot of complication before they actually begin to address it. So, sir, how serious is the hypertension situation in Nigeria right now? Would you say we are facing a crisis? Can we say we are facing a crisis? Or is that word, would you consider it too strong to use in the Nigerian context, sir?
Thank you very much. It is very good and it's appropriate to use the word that hypertension is now a crisis in Nigeria. In fact, um, we call it a disease of epidemiological endemic proportion. It's an epidemic. That means that it's occurring at extreme rates and cut across the strata in Nigeria. So it's a serious problem now, and it's a major cause of what makes hypertension more serious is that it damages different organs in the body. But primarily, there are three major organs in the body that hypertension affects. Hypertension is the commonest cause of heart disease in Nigeria. So when you see people having heart problem, like heart attack, like heart failure, like sudden death from heart problems, all kind of heart diseases like that, that hypertension is the commonest cause. Number one, that's number one. Number two, hypertension is the commonest cause of stroke. So you can see, then you have people have stroke, in which one part of their body is no longer functioning. They can't raise their hand and the limbs at the same time. Then that is stroke, and hypertension is the commonest cause. Thirdly, hypertension is still the commonest cause of kidney problem, especially chronic kidney problems. There are different kind of kidney problem. The most devastating among them is the chronic kidney problem, and hypertension is the commonest cause. So you can see, in summary, there are three major organs, very vital organs in the body. The hypertension damages. Number one, the heart. It causes heart failure. It causes heart disease. It causes what we call coronary artery disease. Number two, it causes stroke. It's commonest cause of stroke. Number three is the commonest cause of chronic kidney disease. Apart from that, hypertension also affects other organs. These are the three major ones But there are others like the highs. Hypertension is a significant cause of, you know, uh, high disease, particularly high problem, visual loss, because it causes what we call hypertensive retinopathy. That is, it damages the retina through which the vision is uh, is elaborated. Then it also affects the vessels. So it can cause what we call peripheral vascular disease. It can like damage the vessels. That is the blood vessels, especially the arterial vessels in the limbs, exactly. And so it can lead to uh, the ulcer and diseases of the vessel. So these are the major ones that hypertension can lead to. There are other diseases, but these are the ones that are very related. Then in the brain, it can also lead to what they call vascular, disease, vascular dementia. Hypertension can also contribute to that, wherein there is a damage to the vessels in the brain, and the people also develop inability to be able to remember things, particularly in the elderly people. So this is the consequences of hypertension. Now in Nigeria, the problem is huge. Roughly, in the recent paper, in the recent research that was published, hypertension is above 30% in Nigeria, meaning that at least 30 out of every 100 adults have hypertension in Nigeria. That is the average figure when you say 30. But it can be high as high as 40% in some countries, but in some region, particularly in the eastern region, the southeastern region. That is among our people, the Igbo people. And so the value range, it's a range of value across the country. But generally, averagely, it's about 30% or 30, you can say 30 to 40% in Nigeria. In some area, in some part of the country, it could be less, but it's a big problem when you have maybe three to four out of 10 adults having this disease. And more importantly, is that it also affects young people these days, the teenagers. It's affect them. So you can see the burden of the disease in our own environment here. So you will hear that people just die suddenly, they collapse suddenly. Maybe they were giving a speech somewhere or they just slump somewhere. If they have the opportunity to do autopsy, you will discover most likely that the cause of that problem is hypertension. Hypertension is the commonest cause of sudden death. So that's why we call it a silent killer, because it will not sometimes, many times, will not give warning to anybody until the person just suddenly die. So you have somebody that is giving a speech, somebody that is addressing the audience, and just slump and just die like that. The blood pressure has been there, the high blood pressure has been there silently, didn't do anything, didn't give any warning to that individual until when catastrophe, occur, and the person just slump or fall down and then die. So this is the scope of the problem, the size of the problem, and the consequences that we face, particularly in Nigeria today. Thank you very much.
I want us to stress it a little bit more, sir. Uh, People have this general belief that hypertension is a thing for older aged group. It's something for older people. I know you mentioned it, but I would really like us to really mention it. Should young people worry about hypertension or having an elevated blood pressure, sir?
As I've said, hypertension affects both the old people, elderly people, middle-aged people, and the young people today, particularly teenagers, people in the universities, even the people that is anybody that's above 15-year-old, hypertension among them. It's not generally common in the young, very young people, but by the time somebody is approaching teenagers, the teenagers, and then adulthood, it's common among them. So it's a concern, and they should be concerned about it, particularly if the father and the mother or the parents of that individual is have hypertension, because this thing can be inherited. It runs in family. You know, in a family where the father or the mother have hypertension, the child should be concerned about the high blood pressure. And the easiest way to be able to notice that is to check. There's no other way to know and to prevent hypertension rather than to check the blood pressure, so that you'll be able to catch it if the thing has started, and then we can address it. These days, it's common among the young people, particularly the teenagers, because of it has been linked to excessive use of media, prolonged use of media, particularly in the night, where they find it difficult to sleep. So there is a lot of mental stress. And so that is why the study have been done among the university students, and they found that high blood pressure has a link with prolonged use of this excessive media, social media. So it is an important thing for every one of us to uh, to address. It is important for us to consider. So once somebody is have a family history that has high blood pressure, the person has to take note of himself. It's the same way. If somebody have family history of diabetes mellitus, the person has to be careful. He has to start watching his lifestyle, start watching, doing exercise, eating a very good food, and so on. It also has a relationship with hypertension as well. Diet aspect. Maybe you are going to get to that. How we can do what we can do to actually prevent high blood pressure, and when people have it, what to do with it. So in summary, yes, hypertension is a concern in the young people, the teenagers and young adults. All right, is common among them these days, and we have to be concerned about it, particularly those who have never discovered that they have blood pressure, but they have the family history. They should go and check their blood pressure, and then start preventive measure as necessary. I have managed people with 17-year-old,
Hmm.
60-year-old. I've seen them in the university who enter the university and the blood pressure is high. And what we have discovered consistently that their parents have high blood pressure. Some of them, the two parents, and so. So any young adult or young people whose parents has high blood pressure, I will not wait the age of 18. 18 is the adult
Hmm.
age in Nigeria. So we will not wait till that 18. Once the person is, at the age of like 15, 16-year-old, and the parent, the family history shows that there's high blood pressure running in the family, the person should check. Because there's no other way that you can know except we check. But for adults who have hypertension, they should just follow the hospital recommendation. They may ask you to come every month. So you have to go and check. Some people, they give them 2 3 months. Some people 3 months when we see that the blood pressure is well controlled. So you give them 3 months because we want to monitor them closely. So that is the age range and how we structure the follow up and the measurement of blood pressure in order to track and to manage hypertension. All adults 18 years and above, they should be checking. If the person has no family history and it's normal twice in a year, that is fine. But if somebody has hypertension and it's something you manage well, he must follow the doctor protocol. Some of them every month they check, some of them every 2 months, some of them every three months they check. But if somebody's family history is there and is young, it's just entering university, and then you see the person has to check early to know whether he has already developed it or not, because it's already running in their family. Thank you very much.
All right. Thank you so much, Prof. Sir. Thank you so much, sir. So, to our listeners and viewers at home or at work or wherever you are, I'm sure you are taking note of these things. Let's not forget the general saying that says prevention is better than cure. At Wellness Dokita, we would say prevention is cheaper than cure. So please let us take note. The incidence of hypertension, even in young people, due to several factors, lifestyle reasons, stress, as Prof just mentioned, stress, and even engagement with social media. We see the case of depression being on the increase, on the rise. Some of these things are associated with some of the things people come in contact with while on the social media. So it's very important. A family history, a father that's hypertensive, mother that is hypertensive, should draw stronger reasons for an individual to go and check his blood pressure. So if you are there, you're watching us and you have not actually checked your blood pressure recently, please do go and check it. Prevention, once again, is cheaper than cure. Thank you so much, Prof, for that. Thank you so much, sir. I want to just quickly go on. I want to also ask, if you have questions, please quickly drop them in the comment section. very soon. We'll be moving to questions from the people. Just 5 minutes or 5 to 7 minutes for that. So if you have questions, maybe some things that we have not touched in the course of this thing before we wrap up, please kindly just quickly drop it. And the one that is most relevant, we are going to bring it to the platform here. Talking about lifestyle, sir, are there lifestyle that is contributing, especially in your practice, that maybe you have seen that is contributing to kidney-related health issues, aside hypertension, that is actually playing significant role in affecting kidney or in people coming down with kidney-related health issues? Are there lifestyles that are contributing, especially within the Nigerian context, sir?
Okay, thank you very much. There are important lifestyles that contribute to development of hypertension. I'm going to highlight uh, some of them, important ones that are associated with high blood pressure. And I will conclude with one more that is very common to us that I will also categorize as lifestyle. Well, let's start. Number one is high salt intake. When people take a lot of salt, it has been shown that salt, is the one of the most important contributor to hypertension. So people should reduce their salt intake. In other words, the minimum salt that people need per day is just very small, just about 3 grams. At the level of the teaspoon, a level of a salt, a level one, not the heat type, you know. And the easiest way that people wants to take small quantity in your meal in the diet, you should not add salt. All this putting salt on the table, that when people are eating, I say there's no enough salt you have to eat, it is not good. So salt is number one. Number two is uh, high body weight. Okay, high body weight. When somebody is excessively big, it can lead to hypertension. So people who are heavy, they have what we call high body mass index, but their weight is very high. They have the risk of developing hypertension. So people should try as much as possible and moderate their weight. The average weight of an adult is supposed to be 70 kg. So, but some people can weigh 90, some people weigh 120. And so when somebody's weight is greater than usual, then the person should check. Number three is in physical inactivity. People does not, they just sit down in one place. They don't move around. That is very, very common in our environment. So people should move around, to exercise. Okay. The two are related, because when you move around, you are exercising, then you are not sitting down in one place. People sitting down, which we call inactivity, is a risk factor for hypertension. Lack of exercise. When people does not, exercise their body, they don't move their body regularly. That is a risk factor for hypertension. Diet contributes more. Lack of, eating vegetables and fruits. Those one also affect, contribute to high blood pressure, because when we take a lot of fruit and vegetables, it contains some of the minerals that are very good for the body, like potassium, which also help to reduce the blood pressure, because sodium, which contributes to high blood pressure, when somebody consumes a lot of fruit and vegetables that contain potassium will displace that sodium, and potassium is a good mineral that will support reduced blood pressure. So these are, then another lifestyle that people adopt is smoking and excessive alcohol intake. Smoking and alcohol intake, they are also very important uh, lifestyle factors that affect high blood pressure. And of course, there may be some medication, substance that people take, like cocaine and all those other substances that can stimulate the person, because the stimulants, all those things can increase, the nerve system, sympathetic system, the nerves that creates fright and flight in the body. So they can arouse that nerves, which will affect the blood pressure. Then finally is that people don't check their blood pressure. I want to consider this as a big lifestyle They are not care about their health. Simply they don't check the blood pressure. Checking the blood pressure and treating the high blood pressure can save 80% of heart related problems that is affecting the community today. That is why we are promoting it, that people should check their blood pressure. People should know their numbers. What is the blood pressure number? What is your weight? The weight, your number in terms of your weight. All right. So people should check their blood pressure because it has a way of making us to diagnose early and to treat. So in summary, these are the risk factors that affect our lifestyle, the lifestyle factors that affect the people. People who are taking a lot of salts, people who do not exercise, people that are obese and have high body weight, people that engage in inactivity, body inactivity, people that consumes less vegetables, less fruits, people that take cocaine and all those substances, and those use some of those drugs. Because people who are careless, they don't check their blood pressure. It's a lifestyle. When you don't care, you just walk, you don't hear it everywhere. As you are hearing it now, people does not care. They don't check. That is a lifestyle. A lifestyle that does not care about the personal health. It's a lifestyle. I consider it as a lifestyle as well. Because we must be considered. Because when you hear something important like this, we should consider. We should we should adhere to instruction. Thank you very much.
Thank you so much, Prof. Sir. We have very, very short time left. Thank you so much for the response. Let me just highlight some of the points that Prof mentioned. So please, let's take note of it, including young people. Remember, prevention is cheaper than he mentioned salt intake. Many times, most people that have to go and eat outside, these are some of the challenges. Weight control is very important. As much as you can, try to ensure that you are not overweight. In some other episodes, we are still going to be talking more in-depthly on what we call body mass index and how to calculate it. So physical inactivity also is also contributing when we have to sit for a very long time. Lack of exercise is part of it. And then poor diets, not rich in vegetable and all that, smoking and alcohol intake. So please let's take note of it. Know your number. You are above 16, you are above 18, you are an adult already. Please kindly go and check your blood pressure and then monitor it from time to time so that as you are noticing that it's beginning to rise, you are taking steps early enough to be able to forestall further damage. Thank you very much. We have some questions here, Prof, that some people are already sending in, and I'm just going to read maybe one or two of them. And let us see if we can quickly just attend to it. So someone is asking, the person is asking, say, thank you so much, sir. Based on our guest explanation, does it mean that high blood pressure is hereditary? If yes, what is the probability that a child would have high blood pressure where either of the
Okay.
parents has a record of it? Yes, sir.
Yeah, high blood pressure is hereditary, meaning that if the father has it, then the child is most likely going to have it. It has even been shown that it's much more likely. The likelihood is higher if it is the mother that has it because of the relationship with mitochondria, which is a kind of uh, organ, or we call the tissue, or what we call that invisible organ within the body that transmits inheritance. So, talking about the specific people, that if the father has some family, what is the chance? Like, is it 30%, 40%, 50%? No, that one will not be able to say specifically. But suffice to say that if somebody has, if the parent has high blood pressure, or both one have high blood pressure, the child is most likely about to have it, and to take caution. Now, so the approach is that once you know that you have the likelihood, your family used to have it, you put in the preventive pressure. You don't use cocaine, you don't use alcohol, you don't smoke, you do exercise, you reduce your weight, you are not overweight, and you don't consume things, excessive salt, and you take a lot of vegetable and fruit. Like this, you are likely to have it. But if the person start living his life early out and start taking, salt I mean, that is all those fast food that contain with a lot of salt intake, and then taking some junks and food that is lacking vegetable and fruits, and you can start becoming overweight, taking alcohol. The person is likely to have it. Hypertension is the number that we look at. There's other things that are associated with this inside the body that we do not measure. It's only the figure that tell us that look, you have risk of a danger of the consequences of hypertension. So that is the relationship, the explanation that we have available to us in terms of inheritance of high blood pressure. It is just so logical and the wisdom to do to prevent, to institute preventive lifestyle measures once the family has high blood pressure. So if a child, if the father has high blood pressure, it's just logical to tell the children, start doing this and this so that you do not have the high blood pressure that I have. Thank you very much.
Thank you so much. So to summarize what Prof said, if a father, a mother is hypertensive, the child needs to be very wary. One of the factors that is modifiable that a child can do is lifestyle related. So avoiding some of the things he mentioned, smoking, drinking, salt intake, and exercise and all the other things that were mentioned earlier. Please, let's take note of that. Someone is also asking, said, okay, we've mentioned it already. I think somebody's asking, what are the causes? What are the causes of high blood pressure? I don't know if we'll be able to attend to that. What are the causes of high blood pressure? The question is, can emotion affect blood pressure?
Yes, emotion can affect high blood pressure, especially those who are hypertensive. Outbursts, aggression, anger, violence can stimulate what we call sympathetic nerve. You see, when people are emotional, when we are angry, when we are shouting, we stimulate the some nerves in the body, which we call sympathetic nerves. This sympathetic nerve has a way of acting on the heart, acting on the vessels, okay, that will now raise the blood pressure. So that is the reason why they usually say that people who are hypertensive should be careful, because some of them, by the time they are expressing that outburst, their blood pressure can rise, can shoot up at that time because of the AIT sympathetic activity. For instance, now, if there is a commotion somewhere or there is a big bang somewhere, like maybe a bomb blast somewhere, or they say, oh, there is fire, there's a sudden, awareness that makes somebody to run. That's what they call fight and flight. That the what make what the system in the body that encourages, that allow that, is the sympathetic activity. It is just wake up around suddenly like that in response to that danger. So that is what happened. And so when somebody is angry, somebody is shouting, they have heightened emotion, the high blood pressure, the blood pressure will shoot up. Okay. Now, if somebody is under constant stress, chronic stress, doesn't sleep well, and is always doing, spending so many hours without rest, chronic stress, can be associated with hypertension. So it is very important to understand that. Thank you.
Thank you very much, sir. So I think your response, sir, has addressed some of the questions that was asked by someone, and we might not be able to entertain more questions further. We will really want to appreciate everyone that has joined us for this session. We call it Prevention First, Prevention First, Prevention First series, and this is episode 1 of it, the silent crisis, blood pressure, kidney health, and prevention. We want to sincerely appreciate Professor Olanrewaju for being here despite his very busy schedule. In fact, he mentioned many other activities he needed to attend to, but he still made time. And we really want to say a very, 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 very big thank you to you, sir. We really appreciate your presence.
Thank you
Thank
very
you
much.
very, very much, sir. Thank you very
Thank
much,
you.
sir. So, all right, sir. To everyone that joined us today, we are very, very grateful. And we are very, very, very grateful. We are very, very grateful. We look up to you joining us in the next episode. It's going to be next month. Tell your friends, tell your mother, tell your father, tell everyone around you. It's a movement to a healthier Nigeria. It starts with just one person. just sharing the story. Thank you very, very much for joining us. Please, thank you so much, Prof. We really appreciate your
All right.
presence, sir. To everybody joining us, we really appreciate you, and we would like to call it a day. Remember, Wellness Dokita is a preventive health education platform that helps you stay healthy, you know, helps you to stay healthy. So please join us. We have a WhatsApp group. The link is just going to be dropped just in the comment section. You can join it to receive more information. Join our Instagram page, join the YouTube. You can just like now as you are watching, and subscribe also, so that the next episode, when it's going to be coming out, you are going to be notified. Thank you very much, everyone. And we wish you a very, very, very beautiful day. Let us see your comments there. Just share how your experience was. Where did you benefit from this discussion? Is there something that you have gotten that you will take home? God grant you good health by His grace. Till next episode, have a wonderful evening. Bye.